Health insurance premium assistance from the Office of AIDS. Hello, I am Kevin Knaus, an independent health insurance agent in California, and I work with a variety of different clients from Covered California, enrolling in off-exchange individual and family plans, small groups, and Medicare. And for some of those people, there is health insurance premium assistance if they are HIV positive. Now, this program to help cover the health insurance premiums goes through the California Department of Public Health Office of AIDS. And they will cover the health insurance premiums up to an amount, I believe it's a little over $1,900 for 2024 for individual and family plan enrollments. That's where you're going directly with the health plan, receiving no subsidy from Covered California. We call that off exchange. Covered California, if that's where you're getting your health insurance and you're receiving a subsidy, they'll cover your portion. There is help for people with Medicare, original Medicare Parts A and B, and employer-sponsored health insurance. Now, there is no help for people who have full scope Medi-Cal because Medi-Cal is covering everything for that individual. So let's look at individual and family plans. Now again, you can enroll in health insurance directly from the carrier of your choice, Kaiser, Blue Shield, Blue Cross, Health Net, and you can submit that to the Office of AIDS and they will cover that premium. And if you are going through Covered California and receiving a subsidy, then they will pick up your portion of that monthly premium. Now, if your income changes during the year or you move and that triggers a new subsidy, either higher or lower, you would obviously need to submit that new paperwork to have that updated. Now, the Office of AIDS and their program, they're sending a check directly to the health plan. So they're not sending it to you. They're sending it directly to the health plan or the providers. If you have Medicare, they will cover the premiums of the Medicare Advantage plans, if there are any. The Medicare supplements, that's where you have original Medicare A and B and enroll in a Medicare supplement to cover the cost sharing of original Medicare, and the Part D prescription drug plan premiums. Now, what they can't do is they cannot pay for the Part B premium of original Medicare. Many people have Part A at zero cost, and regardless, they can't cover the Part B premium. There's no assistance for people who are Medi-Medi, but have both Medicare and Medi-Cal, because those programs are covering all of the health insurance costs for the premiums and the healthcare expenses. And for some people who have their Medicare Advantage or their Part D premiums deducted from their Social Security, retirement, or disability check, that needs to be turned off because again, they cannot send the beneficiary a check. It has to go to the plan sponsor, the insurance company. So that needs to be turned off so that they can send what we call direct pay, and then they'll pay the carrier. Now, the employer-sponsored assistance is a little different. Now, with an employer plan, the employer makes a contribution to the employee's cost of the health insurance. And then there's a payroll deduction for the employee's contribution. So let's say the health insurance premium for an individual that is HIV positive is $500 per month. And the employer makes a 50% contribution. So the employer pays $250, and then they deduct $250 over the course of the paychecks for the month from the employee. Well, again, the Office of AIDS cannot send the beneficiary a check. They can't send the employee a check. They must send it to the employer because the employer is making one payment to the health plan for all of the employees. So The employer receives a check from the Office of AIDS, and then they must reimburse the employee. It's a little bit of a challenge, kind of a hassle, and some people don't want their employer to know their HIV status, so that can be a challenge as well. But there are some other benefits. If you are in the program, the Office of AIDS will look at covering some of your out-of-pocket healthcare expenses. Now, these are healthcare expenses that accrue towards meeting your maximum out-of-pocket amount of the health plan. Once you've met your maximum out-of-pocket, the health plan covers everything for the rest of a year 100%. So these are things like co-pays for office visits, co-insurance for outpatient procedures, any deductibles before you may need to be hospitalized or before you go into co-pay and co-insurance. Those can be covered. Now, sometimes you'll need to work with a provider, and some of the providers, the medical groups, can actually bill the Office of AIDS. Other times you'll need to submit a claim, but you do get a card identifying that you are in the program. Also, spouses and dependents are eligible for the out-of-pocket healthcare expense coverage. Now, what about dental and vision? There can be coverage for dental and vision insurance premiums. Now, for the vision, it has to be bundled within the dental or the health plan. They won't pay an insurance premium for a standalone vision plan. And there are many plans that are dental that do include vision, and some of those are all within the health plan as well. But you'll need to check, especially with your employer plan, how that is all situated. And for Medicare beneficiaries, there's unfortunately no coverage for either the dental or vision. Now, the first step to getting the health insurance premium assistance for the health, the dental, and the vision is you have to apply for the AIDS Drug Assistance Program, or ADAP. And that's covering, that original mission was to cover the cost of the AIDS drugs to, suppress the virus and just keep you just HIV positive and treat any AIDS if that flares up. To be eligible for the ADAP program, you must be a California resident, HIV positive or AIDS diagnosis, 18 years of age, and have a household income below 500% of the federal poverty level. So for a single adult in 2024, that means you can earn up to $72,900. That federal poverty level goes up every year 2 or 3%. And it's based on the household size. So if you are married or do have dependents, the household size is larger, and that maximum income amount is also raised. Another condition is you may not have full scope Medi-Cal, and there is no third-party drug coverage involved that's covering some of those drugs. Now, the ADAP application must be done in person, and there's whole bunch of sites throughout California where you can go and do this. You can call the number here on the screen. You can go to the Office of AIDS and see a map of where the different locations are that you can go to. They have trained enrollers, advisors to help you through the process, because it can be a little bit of a challenge, especially all the documents you need to provide to them. The eligibility is renewed every year right before your birthday, and you have to have all of the documents in 45 days before your birthday. So you need to stay on top of getting all of the documents to the office. And of course, if you're in covered California, the subsidy changes, you need to notify them of that. If you change jobs, you need to notify them of that so they can kind of keep track of everything. But it's a pretty good program to assist people who are HIV positive so that they can focus on their health, maintain it, and continue to be healthy and sustainable. So if you have any comments, you may leave those down below and I will do my best to answer them. Otherwise, for Insure Me Kevin, I am Kevin Knaus.